It's a day with your fertility specialist. Thank you all on behalf of Alps Hospitals for joining the show this afternoon. We love to say very big thank you to our dear viewers. Thank you for liking our post. Thank you for sharing. Thank you for always staying tuned. And I'm excited to always be your host, Ruth Ogogo. Today we have a very, very amazing personality with us. Yes, it's been a while we actually had her on set. So you have her with us today. We have Dr. Deborah Olibi. She's a family physician. She's an IVF specialist as well as a fertility specialist. She's also the IVF coordinator of Alps Hospitals. Wow. So we have the coordinator of IVF. That's more like saying we have IVF itself
Great.
with us. It's good to have you with us, Dr. Deborah. You're
Thank you very
welcome.
thank you very much, Ruth. Always a pleasure to be here.
So, dear
Really happy to
viewers,
be here with you viewers and a happy new year to you all.
yes, it's her first show with us this year.
Mm.
So she's wishing you all, dear viewers, a happy new year. So there's just a lot that is on the pipeline for you today. Keep yourself set, keep your eyes glued to the screen. Drop your thoughts, your comments, your opinions, your questions. Just drop them at the comment section and we'll definitely attend to them. As we get started, share this link with someone, call up someone. If you need to send data to someone just to be a partaker of this show, please do that right now so they don't miss what we're about to get. We're talking about obesity and fertility. So, Dr. Deborah, talking about obesity, maybe
Yes.
that word must sound very, very huge or very, very um, big for some people, or it might sound like a very, very, very should I say an alien word
Word
to
to
some
them.
people.
Yeah.
Yeah. So what's obesity?
Okay. Thank you very much.
Mm.
So simply put, obesity is when you have an excess or abnormal amount of fat in your body. So it's
Okay.
just abnormal amount of fat or excess amount of fat in the body.
Okay.
Yes.
Okay. So if you have excessive fat, it means you're obese or you're tending towards
Obesity.
obesity.
Yeah.
Okay. So when do you say someone is obese, or are there some parameters that you look at and say, oh, this person is already obese or this person is tending towards obesity?
Okay, so there are indices that we use to measure if a person is obese or not.
Mm.
So the commonest one is what we call the body mass index or
Okay.
BMI.
Mm.
So BMI is something recognized by WHO. So using the BMI, we can classify weight into different categories. So
Okay.
normal weight, how is BMI calculated? BMI is calculated by measuring someone's weight in kilograms.
Okay.
Yeah, and this is now divided by
Mm.
the height of the person in meters squared.
Okay.
So, for
Okay.
example, if someone's weight is 40 kilograms and the
Mm.
person's height is 1.6 meters, so you say 1.6 meters times 1.6 meters, get a
Mm.
value. You now say, what was the number I used for the weight?
40.
40
Yeah.
divided by whatever you get from that.
Oh,
You now
okay.
get a value.
So she has just taught you how to
Yes, to
calculate. So you can, on your own, right there, if you know your height and your weight, you could just do the calculation right away and tell us if you're obese.
obese or not, yes. So based on that BMI now, so somebody will be said to have normal weight when your
Mm.
BMI is greater than between 18.5 and 24.9.
Oh,
That
wow.
is normal weight. So if
Okay.
if you calculate the BMI and yours is between 18.5 to 24.9, that is normal. If you have a BMI less than 18.5, you're unfortunately overweight.
Oh,
So you need to add weight.
underweight.
You're underweight. I mean, sorry,
Yeah.
you're underweight and you
Yeah.
need to add weight,
Mm.
yes. Then when you have BMI between 25 to 29.9, that person
Mm.
is overweight.
Wow.
Yes. So obesity is when your BMI is 30 and above.
Okay.
Any BMI from 30 and above, that person is obese. Yes.
Wow.
So that's how weight is classified into the various groups.
So you see, she has just given us a very, very good explanation. Even me in my head right now, I'm already calculating my BMI. So yes, you could actually do your calculations, and then if you fall into this category of on overweight or tending towards obesity, yes, if you're overweight, you're already tending towards
Obesity,
obesity. Yeah.
yes. The risks are
So
already there.
yeah,
Yes.
exactly. So please do your calculations right now. Send the formula to some other people too, so you also know where you fall into, and then you know that this information being shared today is just for you. So we're talking about obesity and fertility. So maybe you
Yes.
should tell us, affect how does obesity affect fertility for the male and for the
Mm.
female?
Okay, so
Yeah.
yeah, so why obesity is of concern is that the prevalence, that the rate, the amount of people that are obese is increasing at an alarming rate
Mm,
worldwide. Usually, before, obesity used to be a problem of Western societies, but we see that
okay.
even in developing countries, even in Nigeria, obesity is a concern now. We even
Mm,
see childhood obesity, which is really very worrisome.
yeah.
Worrisome. We see a lot of children that are obese. So obesity affects fertility in a number of ways, and it does this essentially by causing hormone imbalances
Okay.
in either the male or the female. It
Mm,
also causes a lot of metabolic issues, which we'll see as we go ahead, and then also causes inflammation in different tissues in the body. So
wow.
all these leads to abnormalities that now, affects fertility. For example,
Okay.
in the woman, this obesity can lead to menstrual irregularities.
Oh,
It can
wow.
cause a woman to stop ovulating.
Hmm.
Yes, so if you're not ovulation has to do with you releasing an egg, which a woman does monthly, that is going to be fertilized for pregnancy to ensue. So if you're not releasing an egg, you can't get pregnant. So that's one of the ways that obesity affects fertility in a woman.
Hmm.
Now, it also affects fertility in other ways. For example, it has been shown that obesity also impacts on the quality of the eggs.
Wow.
Yes, so it
Hmm.
leads to poorer eggs,
Hmm.
being collected in this, or being produced in this group of women. And
Yeah.
if you have poor eggs, chances of fertilization happening is already, reduced, and
Yeah.
all that. Yes, obesity can, even when pregnancy happens, this group of women also have a higher chance of having pregnancy related problems, such as gestational diabetes,
Hmm.
preeclampsia.
Hmm.
They are even at a high risk of having miscarriages, is
Wow.
commoner in them. And
Hmm.
then they could also have thromboembolic phenomenons in pregnancy. They could easily form clots in different parts of the body, and if those
Hmm.
clots dislodge, to lodge in a blood vessel in the brain, in the heart, or even the lungs, that
Wow.
could be quite fatal. So, and then even for women that need assisted reproduction,
Yeah.
it has been shown that chances of success for IVF is less in this
Hmm.
group of women,
Wow.
because it has been found that this group of women usually respond poorly to the medications
Hmm.
used in IVF to stimulate the ovaries. And
Yeah.
then when you want to get them to respond, you tend to use higher doses of these medications, and even at the end of the day, the eggs produced are usually fewer, and the quality is also impaired. And
Hmm.
then it has also been shown that implantation is impaired in them. So you
Wow.
can see the whole barrage of issues that excessive fat in the body is causing. Yeah, so
Wow.
those are some of the ways that fertility can be impaired in a woman that is
Okay.
obese. Yes.
Okay, wow. So you see, there's just a lot that obesity has on the woman. So yes,
Yeah.
even in pregnancy, yes, because I was also going to ask about how obesity actually affects pregnancy.
Nancy. Yeah.
But you also mentioned some of the ways that it could affect pregnancy. I don't know if you have something else to chip in
Yeah. So
with regards to how it affects
yeah, so apart
pregnancy.
from putting them at risk of having diabetes in pregnancy,
Mm,
hypertension in pregnancy, even preeclampsia, which is the worst form of hypertension in pregnancy, they
mm,
are also at risk of having stillbirths,
wow.
preterm deliveries. So
Mm,
all this, even miscarriages, a lot
mm.
of miscarriages happen in this group of women, because
Wow.
it has been shown that there's a problem with implantation in them. Obesity affects implantation with them, so they are
Wow.
at a higher risk of having miscarriages.
Hmm.
So it really does a lot.
Wow. So you see, so obesity is not a good thing. Sometimes when you want to call some fat girls, they'll say, "I'm not fat. I'm just chubby."
Yeah, we shouldn't body shame them, but because there are a lot of factors that leads to people being obese. Yes,
Hmm.
some it could be due to poor lifestyle choices, but some
Hmm.
people it could also be genetics. So you
Hmm.
see some people, it's not as if they're eating so much, or they have sedentary lifestyle, but they are still big. Some
Yeah.
of it is because of genetics. Yes.
Hmm.
Yes.
So are there some other factors that could contribute to obesity? You just
Okay.
mentioned
Yeah, lifestyle choices.
lifestyle.
Yes, lifestyle choices. If you're not eating healthy,
Hmm.
if what you're eating is less than what you're burning, you're not active, People
Mm.
that a lot of us engage in
Sedentary
sedentary
lifestyle.
sedentary
Yeah.
occupations that we don't get to expend a lot of energy.
Mm.
Yes, so those are some of the things. And some people that have other metabolic problems, issues
Mm.
like diabetes, even
Oh
hypothyroidism,
wow.
they are also
Okay.
at risk of being obese.
Obese.
Yes.
Wow. Okay, so yeah, you've talked about the impact of obesity on women, on the
Yes.
pregnant women as well, on ladies. So what about the men? Or are they exempted
No,
from
men are
this?
not exempted.
Yeah.
Obesity causes affects fertility in both sexes. So in men, one of the things that obesity does, it increases the body temperature. And we know
Mm,
that, especially for the scrotum is the structure that houses the testis, and that's where sperm is produced.
mm,
For normal sperm production, the testis is usually at a lower temperature than the rest of the body. That's why the scrotum is practically like outside the body,
oh
so that the
wow.
temperature can easily be at a lower temperature than the body.
Hmm.
Usually, the scrotal temperature is at about 34 degrees Celsius, while
Okay.
our core body temperature is about 37 degrees. So you can see that
Hmm.
3 degrees less.
Oh
Yes, so
wow.
but obesity increases temperature
Temperature.
around
Wow.
the testis, and this will cause defective or impairments to sperm production.
Hmm.
So you see that sperm production is, affected in this group of men, and it could even lead to low sperm count or
Hmm.
even no sperm being produced.
Hmm.
Yes, and obesity also affects the genetic, makeup, the DNA of these sperm cells,
Hmm. Oh
causing
wow.
increased DNA fragmentation. So
Hmm.
that you can see it also affects the quality of the sperm. If sperm is produced, it affects the quality of the sperm that is produced.
Yeah.
Yes, and then obesity can affect peripheral blood vessels in
Oh
all parts
wow.
of the body. So
Hmm.
affecting the peripheral blood vessels in the testis,
Hmm.
in the penis,
Wow.
and this could lead to erectile dysfunction in this men, could lead to decreased libido,
Hmm.
decreased coital frequency. So if a
Wow.
man is not having sex, there's no way pregnancy will ensue. So those are
Yeah.
some of the ways that obesity affects fertility in men.
So there's a lot of impact of obesity,
Yes.
and that has aside that, I know earlier on when we started, you mentioned some of the effects that it has on even the general well-being. You talked about
Yes.
hormonal imbalance
Balance,
and all
yes.
of that.
And then
So
predisposes you to a lot of other metabolic issues like
mm,
diabetes. So you even see the link between women that have polycystic ovaries. You see that a lot
some
of them
people
are
should even
obese.
talk about that. Yeah.
Yes, you see that a lot of them
Obesity.
are obese. Yes.
Hmm.
So polycystic ovary syndrome has to do with some hormonal imbalances, and
Okay.
then presence of cysts in the ovary. So with
Yeah.
obesity, this condition is further worsened.
Oh
Yes,
wow.
there's a lot of hormonal metabolic issues such as hyperinsulinemia,
Hmm.
problems with glucose metabolism, and so on.
Wow.
Yes, so obesity will worsen it. So a woman that has polycystic ovary syndrome that is obese has a worse, you know, presentation than
Station.
someone that's maybe a healthy body weight.
Hmm.
Yes.
Wow. So there's a lot about obesity, and um. So, for instance, if you're an IVF specialist, so
Mm.
what's your counsel to someone now that's coming for a fertility treatment? They're obese. What do you counsel them to do ahead of time before preparing for an IVF treatment?
Yes, even if the for person is not even coming for even spontaneous pregnancy
Yeah.
to happen, we
Mm.
counsel that they should lose weight. The American Society for Reproductive Medicine (HASHRAM) said that about 6% of women who have never been pregnant have been having issues, struggles to get pregnant. About 6% of times, it is linked to the fact that these women are obese.
Wow.
Yes, so
Wow.
weight reduction is very important for anyone
Mm.
coming for any kind of conception, preconception. That's part of preconception care.
Yeah.
Even
Mm.
coming for an IVF, will counsel that you try to achieve up your optimal weight. Try to be in a healthy weight, bracket. So weight reduction is very important. We counsel them to lose
As
weight,
I used to
adopt a healthier lifestyle.
I
Yeah.
used to have a friend. She was preparing for IVF, and they had told her that her weight was on the high side, so she's there hitting the gym, starving herself because she wants to, as much as possible, lose weight as
Okay.
much as possible. And I'm like, is starving part of a way to
No, no, you shouldn't starve
to
yourself. You still need some caloric intake because you need to have energy. You need some calories for the metabolic functions in your body to go on as they should.
mm,
Yes, but it's to reduce the caloric intake should be less than what is expended.
mm,
If you have a high caloric intake, you should be able to expend as much so that your body doesn't store them in form of fat because that's what happens when your caloric intake is more than what you are burning, what you are expending.
Mm.
Yes, so it's not just hitting the gym, it's not starving yourself, it's eating more healthy, eating a balanced diet, a diet that is more in vegetables, fruits, less in salt, less in sugar, less in unhealthy fats, more
Mm.
in healthy fats,
Mm.
trans fats and so on.
Oh,
Yes,
wow.
a lot of nuts, all those things. Yes.
Yeah, so viewers, there's a lot about obesity that's cannot be overemphasized. So it's good that even if not for fertility purpose, for you to stay healthy, because a lot of obese people, like she has mentioned, are predisposed to a lot of health condition.
Yeah.
It's anywhere you call them, they are there. Is it hypertension? They
Yeah,
are
so
there.
apart
Is it
from, yeah,
diabetes?
so
They are there.
fertility is just one of reproductive system, just one
Mm,
of the systems affected. So
yeah.
anybody that is obese is at a high risk of developing a lot of metabolic issues such as
Mm,
diabetes we've mentioned, even
yes.
hypertension, heart
Mm.
disease,
Oh,
stroke.
wow, heart.
Yes, even bone problems like
Wow.
osteoarthritis. You could have
Mm.
sleeping problems, have sleep
Oh,
apnea,
wow,
even at risk
wow.
of asthma.
Hmm.
It even puts you at a risk of certain cancers like
Wow.
endometrial cancer, cancer of the
Hmm.
colon, breast cancer. So it's not just for people trying to get pregnant,
Yeah,
or to have
yes,
a fertility
really.
treatment. Everybody, for a healthier lifestyle, everybody should try to maintain a healthy weight. Yeah.
So obesity actually does no one any good.
Yes.
So yes, if one yes, we will not body shame people that are
Mm.
obese
Yeah.
or you find yourself on the big side. But as much as possible, even if you are predisposed to it, I believe there's still a way that you could work on
Yes.
yourself that you wouldn't get to that point. Because now they say fatness is by choice. Yeah,
For
some
most
people,
people,
yeah,
yes.
for
Yes.
most people now they say
Yeah.
fatness is by choice, but still there are some that even with your choices that you've made, if you're already on the big side, you could work on it. Yes, it's the generation we're in. You've seen a lot of people that were very much on the big side, and then they worked on themselves
Yeah.
and they've attained a very good weight. So we're very much concerned about your health, and we're telling you that you should work as much as possible to stay healthy and prevent yourself from being predisposed to fertility issues and other form of conditions that could affect you later on. Okay, so we have a question. At what range or weight can we say a person is obese? Maybe this person should
Okay.
revert back to
Okay.
when the video started, but
Yeah.
then you could
I
still
can just
answer.
quickly
Yeah.
answer. So
Mm.
when your body mass index is 30 kg per meter squared and above, once the number is 30 and above, you're obese. Yes.
Okay,
Yeah.
so hope that answers your question. Yes, but from even when she said, even as a matter of fact, I think once you've hit that beyond
25,
24.9 and you're
yes,
already going to
25,
25
overweight,
above,
turning to overweight.
please
You need to start
start
watching
working
it.
on yourself so you don't
Exactly.
tend towards
Obesity,
obesity. Once you're already
yes.
overweight, obesity is not far
From
anymore.
you, yes.
Yeah, so you should work on that. Okay, so what's your counsel to the public with regards lifestyle modifications, possible ways they could maintain a healthy weight? Because
Yes.
sometimes some people don't just get fat overnight. It's
No,
something
it's
that is a
gradually,
lifestyle
yes.
actually that they've
Yes,
maintained
wrong
over
wrong
time, and then
lifestyle practices, exactly.
sometimes they say when they say, "Oh, for some women that are not married, when they get married, and they're like, they need to see that my
Yeah,
husband is
it's doing
working on
something.
me," and
So
all of
that's the
that.
evidence of
Yeah.
good living.
Yeah. So, and then you just see them, they just add so much, and you're
Yeah.
wondering.
Mm.
So you could, and then, but then there are some that still look good, even when
Yeah.
they don't get so big out of proportion. So, what's your
Yes.
counsel to their lifestyle and how they could still
Yeah.
look healthy, or in quotes, look like their husband is spending on them, but not get obese?
Yeah. So like we mentioned the diet,
Yeah.
a healthier diet, diets
Mm.
rich in vegetables, a lot of fruits, nuts, less in sugar, salt,
Okay.
fat, reduce dairy, milk. Exercise is another thing.
Mm.
Exercise, even something as basic as brisk walking that you do for
Mm.
like 30 minutes, as
Wow.
often as you can do it every day. So anything is exercise, anything that leads to increased heart rate, that you move your body, dancing, jogging,
Yeah, I
cycling,
was even
swimming.
just going to say
Yes,
dancing, because yeah, a
even
lot of people
chores around
enjoy
the
that.
house that you break out into a sweat, your heart rate,
Mm.
those are all forms of exercise. So that also helps. And then reducing alcohol.
Mm.
Cutting down
Oh
on
wow.
alcohol will also help. Then if you're hypertensive, if you're diabetic, having them under control, either through lifestyle means or even the use of drugs, all that will help, to reduce your risk of being obese. And like I really have some genetic problems while they are obese. Those kind of people, these measures might not help them. They might have to take more drastic means. Like some people have to have surgeries, bariatric
Mm.
surgeries where the size of the stomach is reduced to be
Mm.
able to cut down the amount they actually consume.
Oh
Yeah, but those are
wow.
a few people that are at the extremes. For
Extreme.
most of
Hmm.
us, this basic lifestyle practices is enough for you to maintain a healthy weight and to lose weight. So if you're obese, you need to lose weight and then maintain a healthy weight. Yes.
Okay, so this is me just thinking weirdly. Well, um, most of the time when you see these obese people, I'm just trying to digress a little. When you see these obese people, they sweat a lot, and so sometimes you could
Yeah.
even have to deal with. I don't want to say some of them now have to deal with. I don't know if they're not able to wash themselves so
They have a
properly,
lot
and
of
then they now have to
fungal
start doing,
infection on the skin. We
yeah, and
see
all
it
of
now.
that.
Yes,
So I
yes.
did.
We see that a lot.
So I feel
Between the
that's, and
thighs, under
yes,
the
and
breast, you
all
see
you
that.
you see
Yes,
dirt, and you now
yes,
wonder, is this person a
yes.
dirty person, or probably they are struggling
Yeah,
to
so they need to
clean up
get their
themselves.
hygiene has to be touched on, bathing
Mm,
more frequently and so on. Because yes, we said obesity generates heat. Excess
mm,
fat generates heat in the body. We talked about how it affects the scrotal temperature and so
yeah,
on. So
yeah.
the sweat glands will definitely be overworking. So
Mm,
they need to be more conscious of that. Bathing more frequently, change their clothes more frequently, air their clothes if they're not even going to wash it, so that all that sweat
yeah.
goes out. Yes. So
Okay.
personal hygiene has to be top notch for them.
Okay, so as we bring this session to a close, what's your counsel to, okay, maybe we should talk a little about obese women and high blood pressure that want to achieve pregnancy. What do they need to do? For someone that is obese as a woman and she's hypertensive already and she still wants to achieve pregnancy.
All right. So
Mm.
for even for hypertension, one of the lifestyle modifications we encourage for people that are hypertensive is to lose weight, to be have an optimal weight. So this person is obese, so she
Mm.
needs to lose weight,
Mm.
incorporate exercise into her diet. I mean, into her lifestyle, and
Mm.
then a diet less in salt. It has been shown that for every 1 kilogram you lose, the blood pressure reduces by 1 millimeter of mercury.
Oh
Yes.
wow.
So, and then the diet has to be, apart from all those things we talked about, the diet,
Yeah.
low salt diet, very minimal salt in the diet. She
Mm.
shouldn't eat anything artificially salted. That's even worse. That's like eating raw salt.
Mm.
Yes. So
Wow.
a diet, rich in fruits, rich in vegetables, caloric intake should be less. Carbohydrate, carbs should be low.
Mm.
Fats should be low. She
Mm.
shouldn't be frying things all the time. She should cook things in other
Yeah.
ways.
Mm. Not
Yes.
fries.
So those are some of the ways. Yes.
Okay, so we have another question coming up. Well, all this is wrapped towards pregnancy. Even though I think you've addressed this, can I still achieve pregnancy? This is the person asking
Okay.
if her husband is overweight.
Yes, you can still achieve it because we've seen cases of people that are overweight or even obese, but they get pregnant. So there are lots of factors. It's
Mm,
just that we're saying that the chances in someone that is obese of having issues with getting pregnant is higher
mm,
than in someone that is normal weight. But you still see obese people that get pregnant. Yes, so she can still achieve pregnancy. But if there are challenges, it's
mm.
good even for his overall well-being. It's good that the man loses weight.
Wait.
Yes.
Okay, so yeah, keep dropping in your questions. If we're not able to attend to them now, we'll definitely attend to them much later. It's been amazing having you with us, Dr.
Thank
Deborah.
you for having
Thank
me.
you so much. This was a very, very insightful session. Would keep expecting your questions, and we would hope to see you in our next live chat. It's been amazing having you, our dear viewers, once again. Share this link because a lot of information has been passed down here today. So share this link with someone once again so they get what you just got. Have a lovely evening. Thank you.